Hi everyone, it's Dr. Linder. Welcome back. We are still talking about blood, but now we're going to talk a little bit about blood groups. And this is something that should sound a little bit familiar to all of us. All of us probably know, or at least should know, what type of blood you have, right? Are you a blood type A, a blood type B? Are you an AB or are you an O? And how could you find that? Like, simple blood test is really what helps you determine what it is. And it's good to know, should you ever need a blood transfusion, you want to make sure you're getting the right blood. So, simply put, if the blood type of an individual is a blood type A, then that's the only blood type they can accept. So we have a red blood cell that identifies itself as a type A, and it's holding out a flag on the cell membrane surface, and it's saying, hey, I am a blood type A. Okay, so here is an A antigen. This is what I am. And if you put in type B, that will not be good. We don't want B blood. I can only take A blood. So in the individual's plasma, they're going to have an anti B antibody so that if they're injected with B blood, they can attack it and destroy it, right? Now, if they're a type B blood, then they're going to hang out a different type of flag, and it's going to be B antigens. Okay, this is a B protein. I'm identifying myself as a type B blood cell. If this person takes or is injected with A blood, that could be very detrimental. So we want to make sure that they have anti-A antibody, antibodies against that type of blood. Now, if they are blood type AB, then that means they have both A and B flags saying, hey, I got A's and B's. So they can't have any antibody because they can accept A blood and B blood. We don't want to attack it. If they're type O, then they don't have type A or B antigen. So they're going to have both anti A and anti B antibodies. Okay. So, how do we find out what type of blood someone has? Well, they look for something called a glutination. If the blood glutenates or agglutinates and it clusters, then they found out what type of blood they use. So here, this individual is a blood type A. Okay, so here's the untreated blood first. And now they're treating it with an anti-A serum. Okay, so if it's an anti-A serum and they put it in there and it agglutinates and it attacks it, then we know that it's attacking the type A. So if it agglutinates, we know it's a type A. If it doesn't, then they're a type B. Now, if they take another untreated blood and we know that this individual is a type B blood, then that means anti-serum A is not going to have any impact because this has B antigens. So if they inject them with an anti-B serum, it's going to agglutinate and it's going to cluster. That's how they know they're a type B blood. Well, if they're a type AB, that means they have both type A and B proteins. If they use the type A antibody, it's going to cluster and agglutinate. If they use type B, it's going to agglutinate. So they're type AB. If they don't have either, then there's nothing to attack. They're type O. Okay, pretty straightforward. Now, sometimes people are A positive or B positive or AB positive. What does the positive stand for? So at birth, there's small amounts of fetal, babies and mothers could either be Rh factor positive or negative. Okay, so in this particular case, we have an Rh negative mother, and the baby, the first baby, let's say is Rh positive. So the baby starts making these has these Rh antigens, these Rh proteins. So The mother gives birth to the baby, and there's this exchange of blood that can take place. And as a result of that first baby being Rh positive, the mother and now has these anti Rh antibodies that are just hanging here ready. Now, if the mother never gets pregnant again, it's not a problem. It's not going to harm her, okay, at all. It's only going to affect the baby. So if she never gets pregnant again, no problem. If she gets pregnant a second time and the baby's Rh positive, these antibodies are going to attack the baby and it destroys the blood cells. No good. So the mother can take a decoy. She can take RhoGAM. And RhoGAM kind of hits all of these receptors, all of the anti-Rh antibodies get occupied by this drug, and the baby is saved. Okay, so if the baby is Rh positive and the mother is Rh negative, she'll develop these antibodies to the Rh factor. During the next pregnancy with an Rh baby, when she transfers antibodies to the fetus, which is a normal occurrence, the transferred anti-Rh antibodies will attack some of the fetus red blood cells, causing agglutination or hemolysis, breaking down of the blood cells. And that is not a good thing. So thank goodness there's RhoGAM. And again, this is only a problem if the mother's trying to plan a second pregnancy. It's not a problem with the first.